Hey guys, Dave Williams here again with 843 Benefits and Health Marketplace. This video is designed to help people understand the application process on our 843 Health Marketplace website. We put a video together before showing you how to go through the quoting process, and we also want to show you how simple the application can be. Now, because of the identity verification features that are synced with healthcare.gov, there's only so far that we can get on this before it gets to the point where it doesn't make sense to do a demo for it. But we'll walk you through that process, get you to that point, and explain what to expect from there. So last time we talked, we had a application that we were putting together for somebody who was downtown Charleston, 29401, and roughly 30 years old and making $24,980 a year. So we're going to enter that same information in here again. One person, 24,980 is going to be our number. We're going to continue from there. We have our savings and subsidies that we saw before. We're going to continue on that. We're losing our coverage because we've been laid off. Continuing, we're skipping the doctor and prescription sections just to get back to the quotes again. When we get to this page, we know that a nice notice, by the way, regarding COVID-19 and the coronavirus. All these ACA plans that we're looking at cover free testing. All the carriers currently are waiving copays for office visits to have testing done as well. So it's important to know that you can't be declined if you already have COVID-19, and if you're just trying to be tested for it, all those things are going to be covered on these plans. Again, the important thing is in the application process, though, is that it is currently March 27th. If you don't get this done before the 1st of April, your coverage won't start until the 1st of May. So try and get this done if you can as soon as possible. So looking back down at the plans, these are the same numbers that we saw before. We're going to go ahead and take Bronze 4 since that was the lowest premium option and it has good copays for doctors and primary care visits. We're going to add to the cart and then start the application process. To begin, it's just going to ask some basic information, and we're going to put in John D. Doe as the name. We've got a date of birth that equals somebody who's 30 years old and a fake social security number that we put in there. Because that information is fake, it's going to stop us at the identity verification process, and we'll just have to talk through the rest of it. Contact information, so I'm going to ask for your street, city, zip code, and a phone number. And then from there, the identity cannot be verified. There's really not a whole lot of other information you have to put in. But it is going to ask you a few things like asking about a previous loan you had, maybe where you, the county that you live in, or how old you'll be in 5 years. You just have to answer those questions to verify that information. And then it's going to get into syncing with healthcare.gov. And if you have had a policy with healthcare.gov in the past, it'll find that and it'll ask you to update that policy, and it'll pull that information up on our software. If you've never had a policy through healthcare.gov, it'll end up starting a new one for you. The main thing is that as you work through it, you're going to be entering information about your income and again, putting in your annual income. You may not be working right now, which means you might not have a paycheck right now, but the income amount that it's asking you for is your annual income. So estimate, given what you've earned so far this year and what you think you might earn for the rest of the year, assuming that we're going to get out of this crisis in the next month or so, where you think you'll end up. We generally suggest everybody underestimate that number just a little bit, just to make sure if you're not at work right now, that we don't really know when you're going to be working again. So, you can always adjust that number up later on if you need to. But once you get all that information entered, the application will come back to the original site that you were on with the plan that you were choosing and just ask you to verify that's correct. You'll get an eligibility verification notice as well that'll come from healthcare.gov to show you if there's any information that you need to provide to them to show proof of your income loss or loss of coverage. And you generally have about 60 days from the application to get that back to healthcare.gov. If you have questions on any of that part, you can email us anytime, ask us about stuff that comes up, and we can help guide you through that. So again, sorry this is such a short video. We can't show a whole lot of the application from here, but if you need any help doing it, we're happy to get online with you and go through, share screens together and get an application done with you. So good luck to everybody. Please stay healthy, and I hope this has been helpful.